mode. Continue. All right. And can everyone see the screen okay? The whole screen?
Yes, we can see the whole screen.
Okay, awesome. All right. So to get started, we can discuss what is COVID-19. COVID-19 is a coronavirus, and novel means it's new. And it actually encompasses a large family of viruses which cause the common cold, and they typically affect the respiratory system. This virus is new because before the outbreak in Wuhan, China, it was unknown. There was a thorough investigation done in February of this year by the World Health Organization, and they did conclude that there was no leak from a Wuhan lab and that the virus probably originated outside of China, brought in on the frozen food chain. This is a chart showing the COVID deaths compared to other major events in United States history. We constantly update this. The most current data as of September 14th, there's been over 650,000 deaths in the US. As you can see, we are creeping up to the numbers from the Spanish flu in 1918. Total US cases have reached 41 million, and in the last 7 days, it's about 117,000, which is drastically up from the past month. So we are seeing an uptick in cases. And COVID also disproportionately impacts people of color. So this was a study done, and they quit collecting data in March of this year, but it is showing that cases, hospitalizations, and deaths are much higher in the AAPI community and the Black community compared to their white counterparts. So this data is from the 14th. This is showing you the positive cases in some of the different cities throughout the Bay Area. I always like to say that numbers need context. So if you look at the row that says cases per, that's cases per 100,000. So that gives a good comparison across the board for the different cities. So you can see the cases per 100,000 are much higher in Pittsburgh, Oakley, Bay Point, Antioch, more so than the Danville, Lafayette area. You can also see the total deaths on the right side of the chart. So what are the symptoms of COVID-19? The most common can be fever, dry cough, and tiredness. Some of the less common symptoms include the loss of taste or smell, conjunctivitis, headache, nasal congestion. And then the most serious symptoms are the difficulty breathing, chest pain, or loss of speech or movement. It's important to note that a lot of people can be infected with COVID-19 and show no or very mild symptoms, but they are still carriers. So even if you do not feel ill, you could be carrying the virus and still infect others. So when you are infected with COVID-19, you should immediately seek out care from your health provider. It's also helpful to call them and see where they want you to go for care, because a lot of providers have opened separate centers or have different places that they'd like patients to go to rather than urgent care or the ER. So should you get tested? If you have any of the COVID symptoms, you should get tested, as well as if you have come into contact with someone that has had a positive COVID-19 test, or if you work in a high-risk environment, such as healthcare or customer service or grocery store workers, where you do come across a lot of people throughout the day. It is still super important to get tested. Even if you are vaccinated, like I said before, you could still be a carrier of the virus and risk spreading it to others. So testing is still a great option if you ever have any symptoms or do come across someone who does have a confirmed case. So getting tested is super important and can help save lives. I've been tested for COVID multiple times. It's a little uncomfortable, but it is quick and easy. And by having that test and knowing if you are negative or positive, you can make decisions to protect yourself and your community by self-quarantining or limiting exposure to friends and family. And that can help slow the spread of the virus. So how can you get tested for COVID-19? There are a lot of options now. La Clinica patients can call our Contra Costa line to schedule an appointment. Your healthcare provider can set you up with an appointment, and if you don't have healthcare or a provider, Contra Costa Healthcare Services is giving free COVID tests to everyone that lives or works in Contra Costa County. There's no cost for the testing, and there's no cost for the treatment. So there are no barriers to testing if you need to get tested. So how does COVID-19 spread? So as I mentioned before, COVID-19 is a respiratory disease, and it typically spreads through any airborne droplets that are exhaled during coughs, sneezes, yelling, even singing. So any of those droplets that get expelled into the air, others can inhale them and become infected. Another way it spreads is from hands to face. So when you touch an infected surface and then go and touch your eyes, nose, or mouth, that's another way that the virus can enter your body. That's why it's so important to keep your hands washed. So contact tracing is a really important step in stopping the chain of transmission. When someone tests positive for COVID, they can be contacted by telephone, and they will be asked if they were in close contact with other people and encouraged to let them know that they have a positive test so that we can help slow the spread so people aren't unintentionally infecting others if they do not know they've been exposed. During contact tracing, you'll also receive care instructions, and they can help identify any resources that you might need, such as getting food delivered to your home or any other sort of care that you might need if you're not able to leave. You should quarantine for 14 days or more, and they say 10 days after the onset of symptoms, as long as you do not have a fever without fever-reducing medications. And also sometimes you need to completely isolate from your other family members. So how can you protect yourself? Social distancing is a really important way to protect yourself. The aerosol droplets that I mentioned, those are heavy, so when they go out into the air, they have to fall. If you're about 6 feet or more, there's lesser chance that it's going to be in the air surrounding your face from the person that expelled them. Also, vice versa, you won't expel those droplets to other people if you're not that close to them, and they won't inhale them and become infected as well. So this is a little graphic showing the power of social distancing. At the top, you can see if a person is carrying COVID and they do not social distance, they can infect about 2.5 people over 5 days. And if those people don't social distance as well, that can lead to about 400 people infected over a 30-day period. And then the last column shows if that person does social distance and does their part to quarantine, they will not see more than one person a week, and that one person will also quarantine and infect an average of 2.5 people in a 30-day period. So it's really powerful to social distance and quarantine and slow that spread. Another way to protect yourself is by wearing a face covering. So that's masks and face shields. This prevents you from expelling those aerosol droplets into the air that can infect others, and it prevents you from inhaling them from the other people around you. Also benefit is you can't touch your mouth or nose when you're wearing a mask. So the do's and don'ts of face coverings. It is recommended to layer your face coverings. It doesn't help to layer two disposable masks, but a disposable with a cloth above it is helpful. Your mask should fit snugly around your nose and chin. There should be a nose wire to make it tighter on the top of your chin, and you have to make sure that you can see and breathe comfortably. As I said, not recommended to combine two disposable masks, and you don't need to combine if you have a N95 mask. So be sure to make sure you're wearing the correct mask and wearing it correctly to protect yourself. This is a chart showing the transmission probability between masked and unmasked individuals. You can see at the top, if we have a COVID carrier that's not wearing a mask and a healthy person not wearing a mask, the transmission is really high. As you move down, if the carrier isn't wearing a mask but a healthy person is, it gets lower. And then at the bottom, if a carrier and a healthy person are both wearing masks, the transmission probability is very low. So having all parties wearing masks can really help slow the spread. So another way to protect yourself, as I mentioned, washing your hands frequently. So that's hot soap and water, singing happy birthday, washing them for, at least 30, 45 seconds. Or you can use sanitizer, but it has to be at least 60% alcohol. I'd also be wary to check your sanitizers. There, for some reason, is counterfeit sanitizer around. So washing your hands or sanitizing them can kill those droplets that are on your hand and prevent you from getting them into your body by touching your nose, mouth, touching food, and spreading it to other surfaces. So disinfecting frequently touched surfaces is also a great way to protect yourself and your family. Any high touch objects like doorknobs or TV remotes or the faucet in the bathroom, anything that gets touched often, it's a good idea to frequently disinfect it with any approved household disinfectant. And always be sure to read the labels on those disinfectants and make sure you're using them safely and correctly. So the best way to protect yourself is to get vaccinated. Worldwide, there have been over 5.7 billion doses given, and 42% of the global population has received at least one dose. So this is used widely. It's not, you won't be the first or the second person to get it. Many people have gotten it, and the vaccines have been shown to be about anywhere from 94 to 98% effective in preventing symptomatic disease. And the vaccine is not a cure. It does not completely prevent you from getting COVID, but it is a tool to help us slow the spread. One of my favorite analogies I've heard is that the vaccine is like a life vest. If you fall off a boat with no life vest, there's a chance you might drown, but if you fall off the boat and you have a life vest, you'll most likely be okay. So think of the vaccine as a life vest, and it's just another added level of protection to prevent you from getting COVID and spreading it to others. So this is a really interesting chart. This is Contra Costa County's total deaths and the amount of deaths that were among the unvaccinated. About 96% of deaths were among unvaccinated individuals. So the green line is the unvaccinated population, the blue is vaccinated, and you can see starting in about July, the number of deaths of unvaccinated individuals has gone up a lot. Those numbers are slowly steadying as I think more people are getting vaccinated, but this is kind of a morbid fact that the deaths are among the unvaccinated individuals. So it's a really good idea to make sure you and the people you love get the vaccine. So all individuals 16 and up who live or work in Contra Costa County can get the vaccine, and Pfizer is approved to 12 years of age, which it's open to everyone. There's no tier system anymore. You don't have to be a specific worker. It's just anyone in the county can get it. The three available vaccines are the Moderna, Pfizer, and Johnson & Johnson vaccines. As you can see that they're all effective against hospitalizations above 97% and effective against severe infection above 86%. So that's what we're really concerned about. It's not necessarily what we are concerned about transmitting the virus, but this vaccine is helpful in preventing deaths and extreme illness and having to be hospitalized. And that's what we're really trying to accomplish, is saving lives. So mRNA vaccines, there's been a lot of talk about what mRNA is. mRNA vaccines use a small piece of DNA from the virus, and it gets into our body, recreates that small protein, so our body now recognizes it. So now if we ever see that protein again, we'll know that it is a foreign body and we'll already have the antibodies to fight it. So it's essentially preparing you if you see that virus in the future, because we already know what it looks like. mRNA vaccine has been studied for over 20 years and has lots of promise, and it was created quickly because we had the motivation to do so. A viral vector vaccine, which is what the Johnson & Johnson vaccine is, it doesn't contain the COVID-19 virus. It contains a modified version of another vaccine. So it does the same thing. It recognizes those little proteins that are on the virus, and creates that immune response to produce antibodies. So again, we have these antibodies ready to protect us if we do come into contact with the actual virus. So a couple of myths that we've heard from media, from friends, from the internet. One of the myths was that the vaccine was rushed. The vaccine was produced at an extremely fast pace, but it still meets all of the rigorous safety and effective criteria for FDA approval. The reason it went so quickly is because there was an unprecedented amount of funding available to develop a vaccine, as well as a global collaboration to get a vaccine made. Usually scientists don't have as much funding as they need, so this was an opportunity to get it done very quickly because there was incentive to get it done quickly. Another myth is that the vaccine can cause you to test positive for COVID-19 or give you the virus. That's also not true because neither the mRNA or vectorial vaccine contain any COVID-19 virus. They contain proteins or RNA of proteins from the virus, not the actual virus, and it cannot infect you. Another myth is that the vaccine can change your DNA. When we hear mRNA, we may think DNA and think that could be dangerous, but that's not true. mRNA can never reach the nucleus of the cell where our DNA is stored. It simply got into the cell to create those proteins, to create the antibodies, and then our cells dispose of it after we're done using it. It can never alter our DNA because it never gets into the nucleus of the cell. So how to get vaccinated? As I mentioned, there's no more tier system. There's no barriers to getting the vaccine because of your occupation or anything. So if you go to covid19.ca.gov/vaccine, you can sign up for notifications of where you can get the vaccine. cchealth.org can let you know where you can get the vaccine as well. Also, La Clinica is offering vaccines to community members as well as our patients. And we're pretty fortunate now that most pharmacies allow walk-ins. The vaccine is pretty readily available. So if anyone needs it, there are resources all around you that you can get the vaccine as soon as you want it. Also, it's important to protect your mental health. We've been in this situation for a long time. You know, they said 2 weeks in March of 2020, and here we are. So it's really important to make sure that you're taking care of yourself when you're feeling maybe isolated or, you know, sad about the pandemic. You need to make sure that you're feeling supported. And there is a lot of options for support in Contra Costa County. If you have a provider, you can ask them about services they offer. If you don't, Contra Costa County offers some services, as well as 211. 211 is the Contra Costa Crisis Center. You can call or text them if you would need any sort of assistance. There's also emotional support over text if you are not a phone talker. And last but not least, the National Suicide Prevention Helpline is free and confidential and has assistance in a lot of different languages. If you need help, ask for it, it's available to you. So again, a little bit more about 211. Not only does it have resources for mental health assistance, it can also help find resources for healthcare, food access, for immigrant communities and unhoused individuals. They have a fantastic directory online, as well as just calling 211 and someone can help you find what you're looking for. Lastly, I would like to encourage everybody to fight fear with facts. There's a lot going on the internet, there's a lot going on in the media, so it's really important to get your information from reputable sources. Some of the best ones would be the CDC, it would be the World Health Organization, California or Contra Costa Health Services and Public Health. Those are great resources where you're going to get vetted information from renowned people in their field. I would always go for a .org. Those are my favorite to find information from. Anyone can have a .com, but a .org or a .gov is a completely vetted source. And that is all I have for you today, and I'd love to help answer any questions if there are any, or point you in the right direction if I don't know.
Thank you, Jacqueline. So if you have any questions at this time, it's a good opportunity for you to put your questions in the chat. If you have any questions, and then I know there was a new health order that's going to take effect on the 22nd of this month that says you must show proof of vaccination or negative results from 72 hours, including anyone 12 and older for certain locations such as certain businesses such as restaurants and gymnasiums. So please be aware that that new health order takes effect later this month on the 22nd. Today's the 15th. So on the 22nd of this month, that takes effect. And it looks like, let's see if there's any questions on here. There's a question that says, how would you know if the person or student is positive, and how would you differentiate the COVID-19 to a flu?
So me, as well as all other health professionals, are concerned about flu season for just that reason. As far as differentiation, it's going to be very difficult as the symptoms are similar. However, they're going from 10 days from the onset of symptoms and then not having a fever over 102 without using fever reducing medications. But again, I think the schools have contact tracing in place, but you might want to get in touch with your teacher or make sure that your kid feels safe going to school and from school. And if there is someone sick, have them stay home. And if your child is sick, have them stay home. And I wanted to add in the chat, anyone that already is vaccinated, there's a really convenient option to get your vaccine record on your phone that has a QR code. So rather than carrying your vaccine card, if you do somewhere and they ask to see proof of vaccine, they'll be able to scan that QR code and see your vaccine record. So I posted the link in the chat. I've done it, you just request it and they end up sending you a link and you can just screenshot that QR code, favorite it in your photos and be able to show that if you need to show proof of vaccine.
I also wanted to take a moment to show you, if you haven't already registered for our Parent Square account. Parent Square is our new mode of communication for all of our families district-wide. All parents should have access to the Aries Parent Portal. It's how you register your students at the start of the school year and how you confirm their data. And so once you enter your Aries Parent Portal, you're going to see a new tab that says Communications. You're going to click that Communications tab. You're going to need to confirm that, yes, it's you. Yes, this is your email. It may ask you to put in an email and password. You want to just put the same one that you use for your Aries Parent Portal. That'll just happen the first time once you activate your account. You won't have to go through that process. The minute you click on the Communications tab, you'll go straight into the Parent Square. And so it looks very similar to Facebook. You can receive your communications via email, via text message, or you could download the app and access your information that way. Once you activate your account, you then are in the driver's seat to decide when you want to receive your communications. If you want to receive your communications as they are posted, or if you want to receive your communications all in one condensed digest. So if, say you choose email and text message, you're going to get one email at the time you select each day that has all the information that was posted that day. And if you have multiple students in our district, you're going to have all the communications for those schools all in one location as well. I wanted to point out, this is some of the information that's on there. You should have received information this last Friday for free COVID testing that's now available at our school sites effective this last Monday. Of course, since our students are minors, you have to fill out the form. So all the attachments are right there. You just click on a short form. It's an electronic form. You'll fill that out so that your child has permission to partake in that COVID testing. And then it's also right here, you can see The schedule, if you click on that one right there, it'll show you what locations and what times each day are available. And so, for example, on Monday between 7:30 a.m. and 4 p.m. For students at Pittsburgh High School, Parkside and Hillview, they have testing those days available, COVID testing available on those days. And so every day there's different locations. So our schools, all of our students across our district will have the ability to take a COVID test should you choose for them to do it. Since Pittsburgh High School has our largest student population, it is available there in our North Campus building. And that's available for Pittsburgh High School Mondays, Wednesdays, and Fridays. Should you have any questions, you're always welcome to contact your school site administrators. In regards, if you have any COVID concerns, you're always free to contact them. All right, so before we conclude, I see Jackie shared the link on there that has how you can get, if you're already vaccinated and you'd like to get an electronic copy of your vaccination card, she put the link in the chat. Thank you for sharing that, Jackie. And if you don't have any more questions, we'll wait another minute or two. If you do have questions, please feel free to put them in the chat now. I'll also be adding some information that I received from La Clinica. That's a one-page flyer. I will be adding that to Parent Square tomorrow. And so you'll have access to that information. It shows for this month of September and October, all the different locations in Pittsburgh and our neighboring cities, such as Brentwood, Oakley, Antioch, Concord, where there's testing available, where there's vaccination sites available. So it's readily available in different locations, different dates and times. So I'll post that on our Parent Square communications and you'll have access to that information. And then Jacqueline, I was told that La Clinica accepts patients from La Clinica and also community members, and that that they do two tests, first the rapid test and then the regular COVID test. Is that correct?
I am not 100% sure of that, actually.
Okay.
I can contact Leticia, our Leticia, and
Okay.
ask her, and I can forward you that information.
Okay, thank you so much.
You're welcome.
All right, I don't see any questions in the chat, so we'll go ahead and conclude this evening. This session is being recorded, so you'll be able to access it if you want to help share the link with other community members and help us spread the word about the importance of COVID-19 safety. All right, so thank you to La Clinica and thank you to Jacqueline for this presentation. Have a good evening, everyone.
Thank you.
Thank you.